The COVID-19 vaccine rollout is intensifying this week, but for many the rollout has been too slow. The slow pace of vaccine acquisition has also seen phases 1 and 2 overlapping. Well, to look at how things are doing in various provinces, our reporters Heidi Jokus is in Johannesburg, Lethiwe Mdluli in Durban, and Nobesutu Hechana joining us now from Bela in Cape Town. Nobesutu, good afternoon. What's the situation like where you are? You are in Bela currently. What are things looking like as we begin, especially the second week of phase 2 rollout, which is targeted mainly at the elderly, the senior citizens?
So we here in Bela, we're actually about to speak to one person or an elderly who is registered for the vaccine but was complaining about the slow response from the department or from the app. But I did also speak to her sister, who was also saying that she does not want to register in order to get vaccinated because she still has concerns about the effects or the impacts of the vaccine. But we also spoke to one lady who works for, or who is from the Cape Metropolitan Forum, who was just telling us about some of their concerns when it comes to people who are, or persons who are 60 and above in hospitals who are still required to register instead of the department prioritizing them because they are at hospitals. And she was saying that government still needs to do more in educating people in the communities, because as she was walking around or doing her work in the community, she did encounter a number of the elderly people who were saying that they don't want to register, fearing that their information will be out there, and if something happens, people will be able to track and trace them from their houses. So although there is issues of who gets to be vaccinated when it comes to the app, some people who are not ticking all the boxes, like the healthcare workers or people who are over the age of 60, who sometimes when they register on the app, they get those quick responses, are able to register, while the elderly are waiting to get that SMS informing them to go to the vaccination sites. But we also heard from the Western Cape government saying that they've actually had to increase their vaccination sites to sort of like work in ensuring that all people will be vaccinated on time, because there are still some healthcare workers who have not been vaccinated. So as we are on the second phase, the department is also vaccinating some healthcare workers who missed out on the last phase.
Okay, that's Nobesutu Hechana there in Bela. You said you have somebody that you were speaking to earlier, but let me bring in Heidi Jokus, who's been watching the situation. Heidi, here in Johannesburg, tell us exactly where you are at this time here on the Media View this afternoon.
We are currently at Milpark Hospital, Bradan, and what's interesting here is Milpark has only started with their phase 1B program of the vaccination rollout. Previously we saw extremely long queues here, which was part of the eNCA trial, which ended, and then of course phase 1B and phase 2 started last week. But we do understand that Milpark indicated they'll be starting gradually with only healthcare workers and support staff that were not vaccinated under eNCA. So this is why it's extremely quiet here. But we also got a chance to speak to the Gauteng provincial spokesperson, Mr. Thabo Masebe, who indicated to us that they will be ramping up the vaccine rollout program here in the province, also given the fact that the province is currently in the third wave and it's extremely crucial to try and vaccinate as many people as possible. But what's key here, Bradan, is the fact that we do not even know yet where these vaccination sites will be up and running, when they'll be up and running, and there's still much frustration with many people indicating that this has been too slow in terms of the vaccine rollouts, even though Gauteng is leading with in terms of how many people have been vaccinated since eNCA and of course since phase 1B and phase 2. We know that the province received over 50,000 Pfizer doses last week, and we do know, according to the Gauteng provincial spokesperson, an additional 50,000 will be given this week. We know over 30,000 so far have been administered, and And what's also key here, with many people concerned and confused as to how phase 2 works out, is the fact that they are accepting walk-ins at certain vaccination sites. So even if you don't have a voucher, but you are eligible, you're over 60 plus, there are certain vaccination sites that do accept walk-ins. For example, Chris Hani Baragwanath, I do know, accepts walk-ins. Quickly, Braden, I just want to add, we've also spoken to Denosa, who says that government has been very secretive around how many healthcare workers and support staff have actually been vaccinated under phase 1B. Denosa has come out strongly, saying to eNCA a short while ago that they believe that if government can be vocal with regards to numbers increasing and deaths, they should also be vocal with regards to phase 1B vaccinations taking place for healthcare workers and support staff.
A lot of questions coming up there. Let's find out what's happening in Durban. Thank you very much, Heidi Jokos, at Mill Park Hospital in Johannesburg. Letiwe Mdluli, good afternoon. On your side of the world, what's happening as we begin the second week of the phase 2 rollout, while part of phase 1 is still going on?
Well, Dan, at the moment, I'm outside the Eddington Hospital here in Durban, which is one of the vaccination centers that has been identified by the Department of Health here in the province. What I can tell you about our vaccination rollout is that over 55,000 people have already been vaccinated here in the province since last week Monday to last week Thursday. And majority of those people that have been vaccinated are the elderly, which are the people who are 60 years and older. And some of the other people that are being vaccinated at the moment are healthcare workers. I've actually been speaking to the unions here in the province, and they are saying that some of the challenges that they're seeing is that a lot of healthcare workers, or the batch that was left over from the phase 1 vaccination rollouts, are now actually getting vaccinated. And they're saying that because phase 1 was not finished, they are causing some major queues at vaccination centers, and they're saying that this is actually a disruption because a lot of elderly people are heading to a lot of vaccination sites aiming to get vaccinated, but they are finding that because there are healthcare workers who are left over from phase 1, they will have to be in line for a really long time to get vaccinated. So those are some of the challenges that are found here in KZN. But speaking to the unions, they've also said that they have been speaking to the Department of Health here in the province, and they have urged them to increase some of the vaccination sites here in the province, as initially we did have 27 vaccination sites, and the talks are still in place, and there will be more vaccination sites that are going to be erected in a way to just basically combat long lines at vaccination centers. But what we can say is that it's not looking good when it comes to the numbers of COVID-19 here in the province. As just last week Friday, we did find out that over 4,000 people tested positive for COVID-19, and this is not a good indication, and the unions are saying that they are worried about this number because the vaccination rollout, even though it is happening and they are quite happy with how the process is going, it's a bad indication, as it's seen that more people are getting infected with COVID-19, and this might not be a good sign because more people are still not vaccinated. So for KZN, the vaccination rollout is taking place, and more healthcare workers are still getting vaccinated, and over 60s are getting vaccinated. As I just did say, that 55,000 or over 55,000 people were vaccinated just last week. But the unions are still saying that they are speaking with the Department of Health to get more vaccination sites erected so that the vaccination rollouts can take place smoothly.
And faster. I think it's been so slow. Thank you very much, Letiwe Mdluli in Durban, outside Eddington Hospital, at Mill Park Hospital in Johannesburg, Heidi Jokos and Nobisutu Hechana in Bella. Thanks for those updates.